Hello, Mr. Jones. I'm glad to see you here today because I want to talk to you about your high blood pressure. Looking over your family history, your past medical history, and personal risk factors, I'm very concerned about you. You told me about how both your parents died from high blood pressure and that your mom also had diabetes. Your blood pressure has been very high during your clinic visits over the past 5 years since you were diagnosed with your high blood pressure. I'm not sure how good you have been about taking your blood pressure medication over the past 5 years. You have a type of blood pressure called primary hypertension. They don't know the cause of primary hypertension, but they think it is brought on by both genetic and environmental factors. With both your parents having had hypertension, it gives you a much higher chance of developing it, which you have. You also have many of the environmental factors that would also increase your chances of developing high blood pressure, including being African American, having a high-stress job, drinking alcohol daily, not exercising, not watching your diet, and having gained 20 pounds in the past year. You state that you are getting short of breath just going upstairs. All of these factors are clinically significant and make me very concerned about your well-being because you are still young. High blood pressure like yours is called the silent killer. Your uncontrolled blood pressure is doing damage to your body that can be irreversible and may bring you to an early grave, especially if you don't make some lifestyle changes soon. Another type of high blood pressure that you don't have is called secondary hypertension. Secondary hypertension is high blood pressure that is brought on by other medical conditions and sometimes by the medications that treat them. Kidney problems are a big cause of secondary hypertension because you are unable to urinate and would need dialysis. A lot of blood pressure medications are ones that help you excrete excess fluids by making you urinate, which makes your blood pressure go down. If your kidneys don't work, that complicates your health without dialysis, and you would die. A third type of high blood pressure is called complicated hypertension. It can also be called resistant hypertension because the high blood pressure is resistant to coming down to a more normal and safe level despite someone being on many different types of blood pressure medications. Some people with high blood pressure of this kind require multiple types of blood pressure medications, which can be very frustrating. Some of the factors that affect your blood pressure are how hard your heart pumps and how much you weigh. If you are out of shape because you don't exercise, your heart pumps harder. If you are overweight because you haven't exercised, your heart has to pump even harder to push the blood through your vascular system. If you don't eat a good diet and don't watch your sodium, carbohydrate, or fat intake, this will also affect how healthy your heart is and cause you to gain weight. The sodium alone will also raise your blood pressure because it causes you to retain water, which will raise your blood pressure. The fat will raise your cholesterol, and that may cause plaque to build up in your blood vessels, which will also increase your risk of having a heart attack or stroke. Just having your mom having had diabetes increases your personal risk of developing it. And if you don't watch your carbohydrate intake, you may develop diabetes as well, because that can be brought on by being overweight. Drinking a large amount of alcohol daily is also going to affect your blood pressure, and it isn't going good for the rest of your body as well. The really good thing you did end up doing was quitting smoking 5 years ago when you were initially diagnosed with high blood pressure. By not taking your health seriously, you are putting yourself at risk of many health problems that could kill you. High blood pressure can cause your heart to not work properly and make you have a heart attack. High blood pressure can also make it so that your kidneys stop working. And you would need to go get dialysis done 3 times a week, or else you would die because you wouldn't be able to excrete waste products unless you were able to get a kidney transplant. Your high blood pressure could end up making you develop an aneurysm, which is like a weak balloon that develops on an artery. The high blood pressure keeps weakening the balloon, and eventually the balloon pops. If it happens in your chest or abdomen, it would kill you because you would instantly bleed out internally. If it happened in your brain, you could end up having a stroke, being paralyzed and dependent on others for the rest of your life if it didn't kill you first. I hope all this information gives you something to think about. You have many things you can do to work on making your high blood pressure better. Make sure that you take your prescribed medication every day as ordered. Start to exercise daily, even if it is only a 20-minute walk a day. Start watching your diet. I can get you a referral to meet with the clinic dietitian who can help you with your dietary choices. With exercise and dietary modifications, you will lose weight, which will help lower your blood pressure. Reduce or stop drinking alcohol every day. There are classes we can refer you to here at the clinic to help with stress reduction in your everyday life. I hope that you don't mind me talking to you like this, but I'm very concerned about you. I have some patient education sheets for you about high blood pressure to read. I hope you take what I've told you seriously and decide to start making some changes in your life. Do you have any questions about anything that I have told you about?